first one would be the intravenous therapies.
Mm-hmm.
So out of those, well, intravenous it basically means we're introducing the medication, which is usually in the form of a vitamin or mineral, directly into the vein.
Mm-hmm.
And there's a couple of popular treatments that I do and that have been classically done by holistic practitioners or naturopaths. The first one that would come to mind is something called the Myers cocktail. Sounds very appealing to they often wonder, when do I get my alcohol?
Yeah.
So the Myers cocktail, what it is basically a cocktail of vitamins. So vitamin C, B vitamins, and minerals, magnesium, calcium, in a base of water. And it's called the Myers cocktail because it was invented by a medical doctor named John Myers, and he was using it to treat a very wide array of conditions, everything from just generalized fatigue to infections to migraines, asthma even. And when he passed away, another medical doctor sort of took on the responsibility of really studying that cocktail, refining it, and that's Dr. Alan Gaby, also a medical doctor. And he really refined the Myers cocktail into what it is today that most of us use. And so it remains to be just a basic vitamin mineral therapy. And what some of the indications for that would be fatigue. Now, fatigue could be a really generalized thing. So I find that it works for a number of conditions where fatigue is associated with it. One that comes to mind is fibromyalgia, which I do see quite a bit of, which a major component is fatigue, and cancer as well. And then there's just, individuals who feel run down. A lot of sports, I was doing it previously when I worked in the sports med clinic for athletes because it helps with recovery. The exercise fatigue and recovery. So fatigue, it really covers a lot of areas just with that one thing.
Right.
Now another thing that's that comes to mind because of this time of season is allergies. It works very well for seasonal allergies. It actually surprises me a lot of the time that when the allergy is limited, let's say, to just the season, a client might only need 1 or 2 treatments to get them through the season. It works really well for like the rhinitis, kind of runny nose things. Another area of treatment would be for asthma. Use it a lot for asthma, headaches even. And I would almost add to the list some things from what John Myers did and Alan Gaby. I find it works really well for, if I had to name it, I would say multiple medication syndrome. So clients who are on a list of medications or have been through the system and they just are generally depleted. You can almost see it in their face. I find they do really well with that. And whether it be some of these medications utilizing a lot of their vitamins and minerals up in the body, not sure, but it does work really well for that too. So I'd almost add that to the list.
Yeah.
And maybe a couple other things that you can do, or popular treatments for intravenous, would be a high-dose vitamin C. And really the 2 areas that's used for is for cancer, so integrative cancer therapy, and also for infections. So acute infections, really bad cold, the flu, the high-dose vitamin C works quite well for that, and as an ongoing treatment, part of a whole treatment plan for an individual who's been diagnosed with cancer. Lastly, I would say that there's an antioxidant called glutathione, and that definitely has specific application delivered through intravenous method. Within the neurological field, there's actually a good amount of evidence supporting its use in Parkinson's disease for some of the symptoms there. Also for the MS clients I see, it could actually halt a multiple sclerosis relapse if it's delivered quick enough. If you educate the patient, if you do feel like relapse is coming, come see me right away, you could almost stop that relapse with the glutathione.
Mm-hmm.
And I would say most recently, which has been a real surprise for me, but apparently this has been used a lot in Asia, is for skin lightening. So it was, I've seen a couple patients now. It was something that wasn't even on my radar, but apparently there's a skin lightening component, like a cosmetic component to glutathione. So I've seen a couple of people do that for cosmetic reasons.
Fascinating.
Yeah, so that sort of covers the intravenous side of things.
Yeah.
Aside from that, I would say a lot of what I do is balanced in nutritional therapy and counseling and acupuncture. I do a lot of acupuncture. Works very well for the neuro side of things and the pain management side. Lots of evidence to support it. So for pain management, you know, there's few things that I can really compare to the speed in which it works and the efficacy of it for with regard to acupuncture. I do a lot of electroacupuncture, which is using electrical current combined with the acupuncture. I would say if you actually really dig into the research behind acupuncture, most of the really good studies and efficacy for it all use the electroacupuncture. And so that's why I use a lot of it. I even implement some old school therapies that are combined with the acupuncture, one being moxibustion.
Haven't heard of it.
Yeah, so moxibustion, yeah, it's kind of an old school therapy, but basically what it is it's a burning charcoal made out of mugwort, and you apply the charcoal heat over the acupuncture needle. And if you go back to traditional Chinese therapy thinking, what it does is it helps with blood flow and helps with energy flow through the meridians. And I find that patients just love it because it feels nice. And it works really well for, I'll use it a lot for arthritis and specific conditions. So I do a lot of that. And the last sort of specific thing with regard to acupuncture I do is scalp acupuncture. So scalp acupuncture is kind of a newer offshoot of acupuncture that really developed in the hospitals in China. And what they're doing is applying the acupuncture on the head over areas of the brain that correspond with pain or paralysis in areas of the body. So it's used a lot for neurological stuff. And I did some training with one of, I guess, the leading minds right now in scalp acupuncture, Jason Howe. And yeah, it's been a real journey with that because it always catches me off guard with what it's able to help and how quick it's able to help those things. One of the things that really surprised me was essential tremor. So, you know, clients that just have that tremor, hasn't been diagnosed with anything, but they just have that tremor. I've seen it disappear within 1 or 2 treatments. Then there is some maintenance down the road, but they're just shocked because you know they might have had this for years and years and years.